Fleming from the great state of Louisiana for his early reaction to what we know the president's going to say in his radio and internet address this morning. Congressman, it's terrific of you to be here because you, before you entered Congress, were a family physician. So I wanted you to weigh in on the president's plans because the White House now says they've come up with $950 billion in total savings and to pay for that health care reform.
Well, good morning, ladies. With all due respect to the president, one thing I heard right off that I'm very concerned about, he basically said that he was going to save the money on the backs of the providers, the hospitals, the doctors, etc. Doctors and hospitals have been cut to the bone. We have an unprecedented number of physicians who are now no longer taking Medicare, and Medicare is really the model for this single-payer government system. And to give you an example, the only reason why Medicare is even enforced today is because for every family of 4 who's on private insurance, they're spending $1,800 a year to keep Medicare going. And even with that, Medicare is unsustainable. Within 10 years, Medicare will be out of money. So how in the world are we going to take that microcosm of single-payer health care and expand it to the entire nation?
Representative Fleming, you were a medical officer in the Navy. You voted against the stimulus, so you're not the guy who wants to give out money. How do you propose we fix this then?
Well, to be honest with you, Republicans and Democrats alike agree a lot on health care reform. We agree that it should be portable. We agree there should be universal access. We agree that there are certain income levels that need to be paid for completely or subsidized to some degree. The deal breaker is the single-payer system, because if we go with a single-payer system, a government-run system, we're going to have a bloated medical economy that will have inflation as far as the eye can see. It will deteriorate the private system.
If you can hold that thought, because we'll have a lot of time to talk about that. Congressman, thank you for being here. But right now, it is that time, 6 minutes after the hour. I'm Dagan McDowell.